let's talk a little bit about that, because when they go through these 12 weeks, which is pretty, you could say rigorous, you're asking them to make changes to their lifestyle, to go there, to live there, basically part-time job, as you said. When they come out the other side, what's it like? Do you see them, you mentioned the football player, of course, but should people expect to be changed by this in 12 weeks? Should they expect to really see vast improvement, or are they still on a healing journey? What to expect after those 12 weeks?
Yeah, it's I break it down into a couple of different silos. The first one is clinically, what can you really expect? Because I told them I wouldn't be down here if it wasn't for the science and the research and the data, and we need to make sure we stay consistent with that with every client. So that rigorous 3 to 5 day assessment that we do before assessing the brain for those changes, assessing the cognition, the physical performance, etc., we do at the end as well. So objectively, I can show you your brain after the program, how we were able to build new blood vessels, improve the metabolic function, grow new stem cells in the brain, and how it translates specifically to your cognitive scores that improved and your physical scores that improved, your efficiency, metabolism, all of those things. We can objectively show you pre and post. So that way you know for sure what actually happened to your brain and body. That's one side. My favorite part of that final summary meeting is to take an anecdotal experience from the client themselves, or more commonly from a loved one that notices it in that client, saying, hey, you remembered what I told you in the morning, and I didn't have to repeat myself 3 times like I always have to do. And I noticed that 2 months in. And little things like, oh, I can now tie my shoes. I couldn't do that for 10 years. We had one client where physically and cognitively she was impaired, physically getting down there to tie it, and then cognitively just being able to do it. She wasn't able to do. And midway through the treatment, she was ecstatic because she could tie her shoes again. Something so simple. And that's what most people notice. It's these subtle day-to-day things that become a little bit like a light bulb coming off. Like, oh my God, I can do this again. Yes, we have those drastic changes like stroke patients able to walk, but often it's those healthy aging clients that have deteriorated over time where they start to bring those back. And even more, I tell everybody, you're going to do well through this program. You're going to do the best if you really take all the other things around the hyperbarics that we teach you, lifestyle changes, diet, exercise, cognitive engagement. And you have to continue those after the 12 weeks are done. Because this, even though 12 weeks is longer than a quick fix, it's still not done. It's not a stop and start process. You continue those diet changes, lifestyle changes. So when we do a 6-month follow-up for all our clients and we repeat some of those tests, I often see an improvement at that 6-month mark than I did immediately after the program. And I tell folks it's for 2 reasons. Number one, the reason why this treatment is 12 weeks is because we figured that this stem cell production continues even after the 12th week. That's why it's so long. We have to keep that triggered regenerative process going. So you're still making stem cells after you leave here. And if you continue to do all the good lifestyle choices that you learned throughout your 12 weeks, you're going to keep those stem cells going in the right direction to the parts of the brain and body that need it. And that's why you'll do even better 6 months later or even 2 years later.
Yeah. And it seems that after 12 weeks, you've already reprogrammed certain behaviors that were there that were non-beneficial into beneficial behaviors that will continue the healing process through lifestyle, through education, through the stem cell initiation and all other parts of that. So it really is. I appreciated that about you guys, that you're looking at it from the long term. It's not 12 weeks, you're done, go home, keep doing whatever you want to do, and that's it. You're going to keep healing after that. And healing is a lifelong journey. But, those 12 weeks serve as such a catalyst to get them somewhere.